Thank you. Thanks very much for being here. So we're here today to hold a day of action at the legislature. We have about 150 people who've come from across Ontario, from communities whose hospitals have their emergency departments closed or closing frequently, who have all the inpatient beds in their hospitals closed, the obstetrics units closing sometimes without notice, other vital service closures, other hospitals that remain open that are completely overrun, just do not have the resources to take the patients from the entire region that are coming into the hospitals. Full emergency departments, stretchers on hallways in emerge, stretchers on hallways in the medical units, up, hidden sort of from public view, but throughout the hospital in the acute care units, because there are more patients than there are resources to provide for them. I want to say that this is a political choice. It's not a necessity. I heard the health minister in question period today. I thought her tone was completely inappropriate, nasty, and contemptuous of people who are asking questions about what is an absolutely critical issue in communities. The minister's claim that the number of emergency department closures is lower because they're only counting the unplanned closures is utter nonsense. If you live in Chesley, like a bunch of people who came here today, or Durham, or Thessalon, or St. Joe's Island, or, any other community where the emergency departments are closing, if it's an unscheduled closure or a scheduled closure, the fact is your local emergency department is closed. The service isn't there, and that all the patients have to go on to another hospital. And you'll hear today about what that looks like in those hospitals. They're completely overwhelmed. The drives are longer, if possible at all. The waits are longer. The risk to people's lives is more, and those services are gone from their home communities. The fact is, despite all of the money amounts that the minister keeps saying without any context, Ontario funds its hospitals at the lowest rate in Canada. And by far, we're billions of dollars below the rest of the provinces. We have the fewest hospital beds left of any province in the country by far. And, these emergency department closures are unprecedented. They are not diminishing. We've been tracking ever since they really started. There were a smattering in 2021. There were more in 2022, more in 2023, and in 2024, we tracked 1,117 emergency department closures, the most on record, 1,001 urgent care center closures, other closures like obstetrics, birthing units, all the inpatient beds and so on in hospitals. Those are unprecedented numbers. That is not getting better. That's actually more days of closure than we've had ever in Ontario's modern history, ever since it's been tracked. That is unheard of. So this is not a situation that's actually improving. This is a situation that isn't improving. And we want real answers, real commitments to actually provide the hospitals with those resources that they need to keep their emergency departments open, keep their inpatient units open for people. And we want a standard. The minister is supposed to lead. If the minister, who has the ability to direct providers in the health system, if the minister required a standard in which she said you cannot close an emergency department, it's the most vital service in a hospital, you can't close it down, then the hospitals would come back and say, well, then we need this much money and whatever to do it. And they'd have a negotiation. They wouldn't get everything that they want, but they'd get some of it. And there would be a requirement and a standard that these services be open. We have never had such little leadership that the minister claims it's a local decision to close an entire hospital. That has never happened, not in the 45 years that the Health Coalition has been in existence. I would warrant never in the province's history has the minister claimed it is not under their control and their decision whether or not a hospital closes down. She sets the standard. The Ford government has to take responsibility here. They have to provide the resources, and they have to provide the accountability for the hospitals to open those services, and they have to deal with the overcrowding in the other remaining hospitals. So very quickly, I'm going to just introduce you to people in order. This is Pam. Pam's from a large community hospital in Oshawa, and just to describe what it's like for her, she's a nurse. Pam Parks, P-A-R-K-S, sorry.
Hi, everyone. Thank you for taking the time to meet with us today. I am a proud registered practical nurse. I have been a registered practical nurse since 1989. So for almost 39 years, I've worked in the hospital sector, 2 years up north in Timmins, and the rest have been at the Oshawa Emergency. The condition in our hospital, like many of the large town hospitals across Ontario, are terrible. And terrible is actually, if any word is worse than that, it's there. I have a lot of years to compare what is happening now. It has been bad at times, but things have gotten even worse with COVID. We thought after Doug Ford called us heroes and said that he was going to improve staffing and funding, that things would get better. And you know what? My co-workers and myself included, when we hear the premier out there calling us heroes during COVID, we say, finally, they are listening to us. And then it was like we don't exist. And that's how our healthcare workers feel, that we were once called heroes, and now what about us? What about the patients? We're all forgotten again. Doug Ford is talking about making more lean or for the emergency department. And to us, what lean means, that they're going to do lots of cuts. They can't cut anymore. Because I'm telling you right now, if they decide to cut and privatize, healthcare will be on life support, and the life support won't be there to save them. When patients have to wait longer for care, we experience more violence. We have never seen such violence and aggression as we've seen now. And why? You don't come in the hospital to violate the staff that are actually working for you. And why does the patients do that and their family? That they're frustrated. There's no excuse, but they're frustrated. They want care for their family. Staff are trying. We're short-staffed, and they take out their aggression on us. It's not right, and it should not be tolerated. They are now hiding the patients waiting. You hear about hallway medicine in emergency. Well, the employer have gotten a little bit wiser. They moved these people up in the medical areas. And as a frontline worker, I can tell you, truth to gospel, it is so happening. Up in the hallways, patients, your loved ones that comes in, they don't have the dignity. They don't have a room. They don't have any privacy. They're out in the hallway, 24-hour lights like this happening, and you expect people to be there, to be healthy, and to go home. It's appalling. What that means is that the unit has more patients than its staff. They're bringing in the patients, which they need to be there, but they don't up the staffing. Or if they up the staffing for one day, the next day, it looks good on paper, but they're not replacing sick time because, heaven forbid, we don't want overtime. But sometimes the staff member will go in for overtime, not because they want to, but because they want to look after the patients. Patients are pressured out of hospitals when they're medically more fragile and unstable. The whole situation becomes less humane. And you know what? We're here to advocate for patients. I'm telling you, from our frontline workers, we're there. We're showing up. We just need help from the Ford government. They need to fix the situation in our hospitals. We need the resources. And if, heaven forbid, I hope they do, but if they give the funding to the hospital, they need to give accountability, because they hand out these money to them and it doesn't go to frontline or the patient. It goes to the CEOs, their managers and all, and they forget about the frontline and the workers. We're here to say today that on behalf of my members, 3,200 members, Happy Nurses Week. And at the end of the day, I hope we get the help that we deserve. Thank you.
Thanks, Pam. Okay, thank you. And this is Barbara Butters. Barbara is from Port Colborne, where their emergency department was closed under the previous government. Then their urgent care center was reduced to part-time under the Ford government. Now the plan is to close the entire hospital.
Well, thanks, everyone. It's nice to be here, but not for this reason. A couple things I want you to know about Port Colborne. We're a town of about 20,000 people. approximately 10,000 of that 20 don't have a family doctor. So we have 10,000 orphan patients, basically. Our urgent care is their first and only way to get any kind of health care. They run into difficulties. Traveling to the nearest city of Welland, it's about 7-8 miles away. If you are a senior and you can still drive and you've got transportation, great. Except that the ER in Welland is so overwhelmed. We're talking wait times of not 6, 7, 8 hours, but of 10, 12, 14, and even up over 14 hours wait times. So if you're a mom of a small child and it's the middle of the night and you don't have a vehicle, guess what? You have no way to get to the hospital. So it's either a cab, which is expensive, or you have to wait till the next morning. Our urgent care right now is opens at 10 in the morning till 8 at night. Every single morning, there is a lineup outside that urgent care doors for people looking for care. The people at Port Colborne are really frightened of what's going to happen if the decision is not reversed. If that urgent care closes, we're going to be isolated and denied care in a way that we've never, ever experienced in our life. We live in an area, it's on Lake Erie. Port Colborne's on Lake Erie. Welland Canal comes through Port Colborne. The weather patterns can be absolutely vicious. Between Fort Erie and Port Colborne, there's lots of times where roads are closed in blizzards. People can't get in, people can't get out. So without health care in our communities, we are really under the gun here. And if this Ford government thinks for 1 minute that we will stay silent or we will give up this fight, they got another thing coming. Today, I got the little card from the speaker, that welcomes you to the chamber and hopes that you enjoy information and whatever. I got to tell you, I did not enjoy what I saw today. I did not enjoy seeing the Minister of Health stand up and out and loud lie. That is what she did. She tried to say we are getting 600 new beds in Niagara. That's simply not true. It's not true.
They're closing 2 hospitals.
They're closing hospitals. We have some complex care beds in our hospital right now. Those will be gone. Welland Hospital's under the gun. Fort Erie, urgent care, their hospital is also due for closure around the same time. This is not acceptable in the province of Ontario. And I don't know and I don't understand, and I never will, how 40-odd thousand people in Fort Erie who live there, 20,000 in Port Colborne, Wainfleet probably another 4,000 or 5,000. How come we don't count? Why don't we count? I don't get it. We all pay our taxes. We all work. We all try to make a good living for ourselves, take care of our communities. Why don't we count with this government?
Thank you.
So I want to thank Natalie and the Ontario Coalition. Our group is a strong group. We're not going anywhere anytime soon. We're here to fight it out. Thanks.
Thank you so much, Barbara. Okay, and next is Mary Jane Thompson, who's from Thessalon, came all the way down. Good, 8 hours from Thessalon. Thessalon, all the inpatient beds have been closed in their hospital, so there are no longer any inpatient beds. And repeatedly, the emergency department keeps closing.
It was closed yesterday, and it opened again this morning.
And it's an hour. It's an hour any direction to the next hospital in the summer.
When I had a stroke in 2003, Thessalon Hospital saved my life. When my husband had a heart attack in 2013, he was stabilized in Thessalon Hospital and is alive today because of it. We have two of thousands over the years who are alive and well because of Thessalon Hospital. So how now our little hospital is in serious trouble, just like Mrs. Butter said. Well, once it was a thriving resource in our community, it has since been diminished to what it amounts to as a transfer site. We used to have labs and x-ray technicians. I was born in the Thessalon Hospital, but it's now just an emergency site, and then they transfer them by ambulance. The problem is the distances between Thessalon to Sault Ste. Marie is a 90 kilometers away, and if you take into consideration Blind Rivers on the opposite side, and it's about 45 minutes away, and then lots of times people have to go to Sudbury, which is 220 kilometers away. So the distances are astronomical, and the Algoma region has the span of approximately 72,520 kilometers square. We are at the intersection of 129, which goes to Chapleau, and again, there are no hospitals or health centers there at all. So we had a family doctor up until 3 years ago. We don't have any doctors. We have locums, and they are acceptable, but they're not consistent. My friend who had a cancer diagnosis saw 17 different locums in a period of 2 years, and she was just on a roller coaster and almost died. And then finally she got Dr. Hagen in Blind River, and she is back to pretty good health. My friend Angie, and she can't be here today, but because she's going through chemo treatments, but she it means that her father, John Gallup, died alone in a hospital bed 54 kilometers away from his daughter. She was suffering with breast cancer, and she wanted to race to his bedside, but she wasn't there in time, and he died alone. And it was devastating, and still is for Angie. It means that 85-year-old Eileen Johnson, a widow who lives alone and has congestive heart failure, has had to be taken to the emergency hospital an hour away before she could get any assistance because the hospital was closed. It means people have to travel 90 kilometers one way for chemo treatments, and maybe they go every day to the Sioux for that. I'll read you what Thomas Ritchie, a 16-year-old resident with type 1 diabetes, wrote about the following. I have used Thessalon Hospital emergency multiple times for life-threatening issues. It terrifies me to think of what would happen if our hospital wasn't there. We need a secure hospital without closures and more full-time doctors to cover the shifts. Rhoda Goodall said, I had an infection and went septic. If Thessalon Hospital had not been there, I would have died before being transferred to Sault Ste. Marie. We need our hospital and our doctors in Thessalon. So we are desperately, we have a community of Mennonites, community on one side, an Amish community on the other side that uses the Thessalon Hospital because they use horse and buggy. Then we have industry, and we also have the First Nations. They've all responded. I have over hundreds of letters here that I came by myself, but they feel the very same way, and they're desperately wanting the Ford government to reinstate the beds and bring the hospital up to date so that we can attract doctors to Thessalon.
Okay. That was perfect. Thank you so much. Thanks, you. Really moving. Yeah, thank you. I think you really painted the picture of what it means for people, visceral, like very clearly. Thank you. And last but not least, Brenda Scott, who's from Chesley, where they've closed down the Emerge department at nights. It has banker's hours now. And also next door in Durham, they've closed all the inpatient beds and they've closed the emergency department at night. Virtually all of the services that make a hospital, which is why we're demanding that the minister set a standard and require that standard be met. Go ahead.
Good afternoon. Some of you may recognize some of us because we've been here before. This has been going on for a few years, and while this makes a very interesting day coming down here and meeting everybody, it's somewhat distressing that we have to keep bringing the same message. I'd like to start my remarks with a little comment to the Minister of Health. Rural Ontario matters too. There's no reason that we should have to accept compromised health care and less services than people receive in large urban centers. So, okay, I live in Grey Bruce. As Natalie mentioned, I live in Chesley. You've probably seen our name in the newspapers before. Chesley and Durham are two beautiful small towns. If you ever get a chance to visit, you're all welcome. The towns are about 25 minutes apart if you obey the speed limit. And we both of them have hospitals that have been supported and financed by the local members of that community for about 100 years. That's a long time. That's older than me. So both of these communities matter. In 2022, the local board, now just let me give you a little bit of information. These two hospitals are administered by the South Bruce Grey Health Centre. That's our board of directors. They have 4 hospitals under their tender care. 2 of them are not fully functioning. That's a 50% hit rate. And so in October 2022, they booked the community center for a meeting about our hospital in Chesley. Promoted it for 1 full day before the meeting took place. And when they set up the room, they set up 25 chairs for the audience. 450 people showed up. It was kind of funny seeing them scramble for chairs. They announced then that our hospital would close until December, and then they would see what they could do. The emerge, sorry. So what they could do is they reduced our ER hours to part-time. And through 2023, every time there was a closure, they would announce it on their website. Sorry, the ER is closed today in Chesley. But they like to play with numbers. So now what they've done is they've just put on their website that the permanent hours for the Chesley Hospital are 7 a.m. to 5 p.m. weekdays only. So they don't count anymore if you have an outage during that time. Durham, a few months after Chesley was impacted, their hours were also cut, 7 a.m. to 5 p.m. They have weekends as well, so 7 days a week they have 7 a.m. to 5 p.m., and they don't count similarly to us. If you go on their website, it'll say that's their permanent hours. So they don't count them as outages anymore. So the numbers you're seeing are not really very accurate. We have an issue also in the Durham Hospital in April last year. The board of directors held a meeting to discuss the inpatient beds in the Durham Hospital. You can find the minutes for that meeting online. They had opened the meeting. 1 minute later, they went in camera. Half an hour later, they came out of camera and passed a motion to say, we'll pass the motion that was discussed in camera. The next day, they told the people of Durham they had decided to move all of their inpatient beds to hospitals in Walkerton and Durham. No consultation with the local community. Nobody had a chance to say anything, including elected officials. And those beds are still in Walkerton and Durham. The people in Chesley and Durham demand from this government better than we've been getting. We feel there are issues with the South Bruce Grey Health Centre. We want to be properly consulted, genuinely consulted, on the activities and the future of our hospitals and our inpatient services. Thank you very much.
Thank you. Perfect. That was great. Okay, I just want to recognize the Health Coalition is nonpartisan. And when we book the media studio, the rules here that we book through a political party. France has graciously sponsored the media studio for us. I wanted to invite her and just recognize Mike Schreiner is here and Adil Shamji was here, but just had to go. Okay.
Good afternoon, everyone. I just want to say thank you to all of the volunteers from the Ontario Health Coalition who took the time. It's not easy coming to Queen's Park. For my good friend from Thessalon, I live in northeastern Ontario. Believe me, it's a heck of a journey to come down. But this is how motivated they are to fix their hospital. We all depend on our hospital. Our family depends on them. And they are speaking with one voice. They know what they want. We live in a democracy. You will get there. Your voices are powerful. You're being heard. Thank you for being here.
Thank you, Franz. So any questions for anyone? And the people are here if you want to talk with them separately.
Do you want to just revisit the standard that you're asking for?
Yeah. There should be like a minimum expectation of what services, what it means to be a hospital, you know? For example, when they closed the Fort Erie and Port Colborne emergency departments, they took the hospital H's off the hospital. The same thing in Minden. But now we have hospitals where there's no emerge after 5 p.m. or it might be 7 p.m. or it might be 8 p.m., different times in every town. You have to go on websites or Facebook pages and try and find it. It's ridiculous. A hospital has an emergency department. It has a lab. It has inpatient beds. It has continuing care beds. It has at least a palliative care bed so people can die closer to home. I mean, there should be a minimum standard. It's been talked about for a number of years with the hospital leadership. So we're calling for a minimum standard that says that you cannot have a hospital with no inpatient beds and no emergency department. The minister should set that standard, require that the hospitals find it, and have their discussion about what resources are needed to make that happen. And the other thing is that for those hospitals, you know, like why is it that Chesley, you know, your hospital emergency department is closed, so is Durham very frequently, but Hanover, which is a standalone hospital, is open. It's taking the full load from them and is completely overwhelmed, but it's managed to keep its emerge department open. You know, in Geraldton, the hospital, which is way remote, I mean, it's way up north. It's north of the Trans-Canada. You know, they've kept their emerge department open. The board voted to, you know, support going into deficit to keep the emerge department open when they are required to do so. And over the years when we fought to closures, ministers have intervened, and suddenly, magically, the hospital is able to find the doctors and the nurses and the health professionals to keep the services open. There has to be a standard, and the minister actually has to step up and take ownership here and set that standard. Sorry.
Health minister said that she would not limit the use of staffing agencies at public hospitals. And within the province, they've spent $9.2 billion on for-profit agencies from 2013 to 2022, a report found. So what are your thoughts on this?
Yeah, well, you know what? You're wondering why hospital emergency departments have trouble staffing at night and on weekends. Well, because when you move, if the nurses move to staffing agencies, then they pick their hours. They only work the hours they want. They can work the daytime weekday shifts and not have to work the overnights and weekends. And they're paid double. And so if you're Pam, in an emergency department, you would be working next to another person who's earning double what you are and has only the good shifts that they want, while you and your colleagues are keeping the hospital open overnight and on weekends. Why would the health minister not intervene on that? It's corrosive. It's corrosive to the workforce. It creates worse staffing crisis. And it drives up costs enormously, takes costs away from hospitals, from, Pam talked about money going to CEOs and so on. Billions are going to the for-profit staffing agencies away from actual care. So the real question is, okay, minister, why would you do that? why would you not require, and it has been done before, when George Smitherman was health minister, he put money to the hospitals and required that they hired RNs and RPNs, a certain number, and gave the nurses sign off to ensure that it actually happened in those hospitals. So they can do that. They can do it. And it's in the legislation on long-term care that they're required to minimize their use of agency staffing. You know, the minister can do it. There's precedent for that. She's choosing not to. I mean, the only people that really benefit are the for-profit staffing agencies at the expense of our healthcare.
And the NDP MPP has put forth a motion to eliminate hospital parking fees. What is your organization's thought on that?
I mean, like, we want hospitals to have more funding, but not at the expense of cancer patients or the elderly. I took a patient to a hospital for an outpatient cancer treatment. It was $18 just for the parking. And it's gotten to this. When this started, the hospitals were told to find other streams of revenue as the sort of reducing hospital funding to below the rate of inflation. This is about a decade and a bit ago. And so they were allowed to raise parking fees, or they were told to look at parking fees, but to market rates. Today, most hospitals have parking fees that are far higher than any other parking in town. And they've taken out all the meters around the hospitals, so you have to go into the overly expensive hospital parking, and patients won't be able to walk. You know, they'd have to walk too far. I mean, come on, really? That was not the intention here. In one town, that foundation bought the church parking lot across the street and erected a wall so people can't park for free in the church and walk across. They have to pay for parking. Like, if that's not a user fee for healthcare, what is? We 100% agree with the motion. That should be public funding. And when it happened, it was done to fund corporate tax cuts, actually, billions of dollars of corporate tax cuts. So, while we were, having austerity budgets for the hospitals. And so now hospitals are funded at the lowest rate in the country. Healthcare is almost at the bottom of the country. And we just have way too little capacity and more user fees for the patients. It's not the right formula.
Are there any conversations right now about reversing some of these closures of urgent care? I'm thinking specifically of Port Colborne and Fort Erie. This has been quite the conversation for many years in those towns. Is there any movement from the government in these conversations about reversing that decision?
Well, see, the previous minister intervened. They were going to close the Well and Emerge department. We did the same thing. We had a day of action. We brought people in on buses. We, had the galleries. We had questions, all kinds of petitions and so on. And at the time, it was Eric Hoskins who was the minister, and he intervened and told the hospital they couldn't close the Emerge department. This minister says it's a local decision. And, in the previous government, Wallaceburg, they tried to close their Emerge department. The minister intervened and stopped it. In Midland, they tried to close the ICU and the birthing. In Leamington, they tried to close the birthing. And we did the same thing. When we finally got it to the minister's attention, ratcheted it up at the pressure in Queen's Park, the minister intervened and got a solution and stopped the closures. This minister just, insults who's asking the question and shrugs it off and says, we're spending a lot more money. And that's it. There's just never moves at all on the actual question, which is, will you stop the actual closures? Okay, good. Thank you very much. Okay, we got ahead of